We are just 3 days from the end of Governor Kate Brown's prohibition on non-emergency dental procedures. The Oregon Health Authority still has to come out with guidelines for best practices, leaving hygienists concerned about how they can do their jobs safely.
I'm scared. I'm sorry. I don't want to be forced to go back into something that's scary like that.
By phone, dental hygienist Annette Hahn told us she's concerned about trying to do her job when she works in a patient's face. There's not enough tests to know who has it and who doesn't. And remember, dental offices donated their personal protective equipment, including masks, to hospitals, and are now having trouble buying replacements.
Usually my PPEs protect me enough, but with an airborne virus like this, it's novel. I don't have those available to me. I don't know if there's enough N95 masks for me to change after every patient. I would also want a face shield.
And today we learned OHSU will not schedule any dental appointments in the entire month of May, despite the governor lifting the ban on May 1st, Friday. The School of Dentistry is in the process of determining how it can safely begin to provide non-urgent dental care to its patients again. And last week, the Oregon Dental Association told us they're working with the state on how to keep patients and staff safe.
Dentists aren't going to go back to work until they have the proper PPE.
The American Dental Hygienists Association is still calling for states to postpone elective procedures. One of the big concerns, something local dentist Julie Spaniel showed us yesterday.
Look at this. I mean, that's what we blow around the room.
I use an ultrasonic cleaner a lot. It helps me with people with periodontal disease, which my practice has a lot of patients with that, or a lot of tartar, and that even increases the aerosol factor.
The Oregon Health Authority had a meeting yesterday to discuss guidelines with professionals. We're told they could be released as soon as tomorrow.